SHoKE stands for Students at the Heart of Knowledge Exchange. We take university knowledge and research and we help partners make an impactful change.
We want to, with our partners in the NHS, so that's the Mid and South Essex Foundation Trust, and our stakeholders in Basildon, so people like Basildon District Council, Essex County Council and local groups. What we're trying to do is make Basildon a better place for what's called the social economy, so people who are starting social enterprises, voluntary organisations, third sector organisations they're sometimes called, to tackle social problems. And the area of focus for Social Spark in particular is around health, social care and wellbeing.
The topic of the spotlight really interested me because it's about, how can we contribute to actually helping people in the town of Basildon. It just, really looked like something I wanted to be involved with.
I joined Spotlight on Social Spark for its unique diversity and learning opportunities.
The topic was something that I'm very, very passionate about. So I'm passionate about public health, I'm passionate about social impact, passionate about social change. And this was a perfect combination of all my passions in one place. And I thought, what better place to be than Spotlight on Social Spark.
The idea was on how to support parents in Basildon with ad hoc childcare to enable them go back to work.
My original initiative is to empower people with long-term health conditions by the means of social prescribing. But after 6 weeks teamwork, we developed the initiative into exercise as soon as possible.
Minorities, just because they do face health inequalities when it comes to cooking. So that was the main bulk of the idea.
Social Spark project, I've taken into consideration of my own personal goals, how I could implement my ideas, my plans, and I could see in real time how getting the feedback from my team members. So it was a really good experience, and it was actually a knowledge exchange with myself and my team members, with SHoKE team, with the stakeholders.
Wanting to go into the public health field, you're always going to be working in a team. So having this experience before I've actually graduated, it highlighted to me the importance of being able to communicate effectively.
I work with children and I'm really committed to just improving children's outcomes and life chances, and the parental support network and ATF's work in general is all about supporting parents and young children. And so that, it really lines up with what I want to do.
I think that the whole project has been so successful because of the dedication of the students and the time that they put in to meeting ATF staff, being able to present to us what our areas of development are, and from that we've actually put a plan together to be able to offer more to our community, and that's all been thanks to SHoKE team and their valuable research. And the way they work together is amazing, and they really listen to our ideas and they put those forward for the presentation as well. So just a thank you for all of us at ATF to the SHoKE team.
What it's really helped is it's helped to shape the direction we're working as a team. So our Find Your Active partnership, it's helped us to kind of better understand different areas we can be impacting and different things we could be looking to achieve. I really enjoyed the project. I really enjoyed working with different people with a range of experiences and expertise, and I enjoyed the step challenge that they did along the way.
It was great to work with the students to get a new perspective on the needs of our organisation and how we can support the borough. We'll be using some of the ideas the students have put forward around micro-volunteering and the gamification of volunteering in general, so that was very, very useful. Working with the students has given us new insight, so we've been able to see what we're doing from a different perspective and learn from it, so it's been really good.
It was really key that we kind of captured a new cohort of people in terms of nutrition education and how we might be able to deliver that kind of information whilst working on a budget. What we were looking for was a framework to kind of move forward and grow and develop. And the project went really well. The team were really open to our comments and suggestions on how the programme might be developed. And I think that the team really homed in on that. I feel like if we can develop this project and really bring this forward, that it's going to have a great impact on our communities.
We've already had some really great feedback from our partners who have worked very closely with the project teams. They have been really impressed with the standard of work that's come forward from the project teams, the amount of detail that they've put in to their projects, and their understanding about Basildon and the work that's already happening there, and being able to come up with ideas that are practical and could be implemented. So we can already see that there are a few things that our partners are looking to take forward, and I think it's quite exciting, the opportunities now of where this may lead to.